A Maryland man battled coronavirus for nearly 30 days in an intensive care unit. Now he's telling CNN about the recovery he and his doctors are calling a miracle. Here's Miguel Marquez with the story.
I'm a miracle. Yeah, I'm a miracle. A lot of people in the hospital call me medical miracle.
18 days on a ventilator, nearly 30 days in the ICU.
And I'll take this syringe here.
3 times intubated, a tracheostomy. His throat healing, he still eats through a tube.
Right here is my stomach tube.
At the worst, his heart nearly stopped beating. The miracle, he's alive.
Is there a point where you realized this may be it?
There was a point where it hurt to take even one breath. And I did actually at one time just want to die. But then I heard a voice in my head that said, "You're being selfish."
Selfish because he thought he'd mar graduation for one daughter and a birthday for another. He had a wife, 2 parents, a church, and friends that loved him. He also had a team of doctors, nurses, and respiratory therapists caring and pulling for him.
You know, the whole time that he was here, you know, I don't know if our patients can hear us or if he even heard it, but I used to tell him, "Don't give up." And I don't know if he heard that, and I would like to know if he heard me saying that to him.
Kevin says he does remember that. He wasn't sure if he imagined it, but he remembers it and a nurse named Beth.
She's the one that comes up and told me, you know, I was there the night you almost died. And, you know, I'm like, I knew nothing about that.
COVID-19 keeps patients like Kevin sedated and separated from loved ones. Medical staff wear masks and gowns, hard to know who's who. Beth Gelston was in the room on Swink's worst day.
He started to crash.
This is when his heart nearly stopped.
It did. So I was caring for him that day and in the room with him while all of this was happening. And when I saw him on the day that he left the hospital, I told him that. I told him that he almost died and I thought he was going to die. And I'm so thankful that he didn't.
Kevin Swink now an inspiration for the staff that saved him.
How do you cope with patients as sick as Kevin?
In the beginning of all of this, it definitely wasn't easy, and a lot of us left in tears a lot of the time. But I really believe that we've become together as such a support for each other. And also seeing people improve, it's helped. Like the fact that Kevin is home and doing so much better, it helps. It really helps us to know that we're making this much of an impact.
Kevin Swink, not typical in another way. 50 years old, no underlying medical conditions, otherwise healthy. Another COVID-19 mystery. Some, for reasons still not understood, get deathly ill, while others barely know they have it.
Is very confusing to us. And, you know, I think there are people that are looking into why this might be. You know, could it be related to genetics? Could it be related to the viral load or the amount of virus that the person's exposed to?
Kevin's recovery as mysterious as his illness. His father also tested positive and may not recover. Other family members got it too and were barely affected.
It just blindsided me. I didn't think I'd get it. I didn't think there was any possibility or anything like that.
When he was discharged, his church organized a drive-by parade. Kevin will see graduations and birthdays. He's looking forward to solid food. A double portion of Maryland crab cakes.
How sweet is life?
Nice. Very sweet. Very sweet.
Definitely down with the Maryland crab cakes. Miguel Marquez joins me now. I'm sure you are too, Miguel. You know, Kevin isn't the kind of person that you think of in the most at-risk categories. Does this case help highlight just how much still we have to learn about this virus?
It is the most frustrating thing. So many members of his family also got it, and people he knows. Others, they went through it, barely even knew they had it, barely a fever. He almost died. His heart was that close from stopping. It is just incredible how they can't quite figure out how this disease works and why it affects some people so much worse than others.
Yeah, but I love that he said, I can't be selfish. I have others to think about than myself. I'm not gonna I'm not going to die. Miguel, thank you. That was a really great piece, and we really wish him the best. Thank you, Miguel. Stay safe as
He
well.
still hasn't gotten those crab cakes. He will soon, though.
He will. Well, give us the address. We got to send him some crab cakes. I promise. We'll send him if you give me an address. I'll make sure he gets some crab cakes.